What you're about to witness is a patient who has been smoking 2 packs of cigarettes and drinking a fifth of whiskey a day. She started these habits at the age of 14 and was diagnosed with hypertension at the age of 22. She was recently also diagnosed with cirrhosis of the liver. She is now 36 and has been non-compliant with all medications and diet regimens, and she frequently misses doctor appointments but decided to come in today for her checkup.
I don't care about that thing anyways.
Miss Smith, you can come back now.
It's Trixie.
I'm sorry. You can come back to the room now.
Now that you've met Trixie, what are your thoughts? What could be going on? And what is wrong with her psychologically? Have you noticed anything different? Before we move on with the story, we'll give you a few seconds to think and come up with a hypothesis on this patient.
Hi Trixie, how are you doing today?
Might be better if I wasn't here, so if we could hurry up, that'd be great.
Okay.
I got a nail appointment, actually.
Well, do you know why you're here today?
Because, do you not have it written down?
I do. You're here for a checkup. I was just saying, do you have anything to talk about or anything?
I mean, I can always talk, but talk to my friends.
All right. Well, if you'd like, I can just begin the assessment.
Yeah, that'd be great.
And get you out of here, okay? So I'm just gonna take your blood pressure and listen to your heart rhythm.
After assessing Trixie, her blood pressure is 180 over 110, her oxygen on room air is 86, her heart rate is 110 beats per minute, her temperature is 98.9 degrees Fahrenheit, and her respirations are 24 breaths per minute. What are your thoughts on this? What are some symptoms that you think she might be having along with these vital signs? I'll give you a minute to ponder and write down your thoughts. Lastly, what do you anticipate the doctor doing next?
Trixie, I've taken your blood pressure, and I'm very.
Oh gosh, I just really wish I had a lighter.
I'm sorry, we can't do that here. But your blood pressure is very concerning to me. I got 180 over 110.
High score. That's a new high score. Just kidding, that actually didn't beat my high score.
Yeah, well, I'm very concerned, and I'm gonna go ahead and call an ambulance for you, because this is really concerning, okay?
Pause. Do you got ambulance money?
We don't need to worry about that right now because we want to save your life. Because what this high blood pressure can do is cause a stroke or a heart attack.
Yeah, well, that's a lot of money. So,
But
I
right
don't know
now,
how I'm supposed to afford that.
I don't want you to be concerned about that money, and we can figure out insurance and all that after you're okay.
That's probably easy for you to say because you're a doctor.
I understand your concern, but I'm very concerned that you won't make it if you just go home.
I guess I wouldn't have any bills to pay, but that was a joke. I'm just kidding.
Okay.
That was great. Here comes Fred Mark.
All right. So, do you have any family or anyone that you want me to notify? Because I'm going to go ahead and have my assistant call the EMS.
Well, can you call my dog?
Yeah, we can let your family know to tell your dog. But do you have anyone out in the car?
Well, my dog just had his eyeballs removed, so I need someone to take care of him. Pretty stressed about that. But I guess you can call my I guess you can call my sister, even though she gets on my last. Go ahead and call my freaking sister.
All right.
Rotten.
I will. Is she here today, or is she?
Unfortunately, yeah, she drove me. She doesn't trust me to drive, so whatever.
All right. Well, I think it's in her best judgment for you not to drive right now, because I think you might be a little bit under the influence, but that's just
With a good time, maybe, yeah, I guess.
Okay. So. I'm gonna go ahead and call your sister, or I'll go get your sister. Is that okay? And you just stay right here. We don't want you to go anywhere right
Well,
now.
I definitely was not going to be getting up to go get her, so.
Okay.
I mean, yeah, I guess you could go get her. That's the least you could do, since I've got to pay for an ambulance now.
All right. Well,
Bye. Thank you.
Well, Trixie is now complaining of a headache, 10 out of 10 on the pain scale. She also says she is anxious and may need to vomit. The med tech told the doctor she seems a bit more confused than she was earlier.
hi. Are you Caroline, Trixie's sister?
Yes, is everything okay?
Well, actually, I took her blood pressure just a few minutes ago, and it was pretty high. I'm actually very concerned because this can actually cause a lot of problems, like neuro issues with the brain. She could have a stroke or a heart attack, plenty of other things, and we just want to prevent that, and we need to get her blood pressure down. And so I have already called EMS. They're on their way. If you want to ride with her, or if you just want to drive separately.
I'll drive separately.
Okay. Do you have anything to say? I know this is a lot.
I told her to quit smoking and drinking.
Yeah, she definitely does need to do that, but we're really worried about her blood pressure, and we just need to get it down right now. So we don't want you to say anything and cause any stress, because that can cause it to go up.
Okay.
All right.
Has Trixie improved, stayed the same, or declined? And why is that? Also, can you think of a nursing diagnosis?
Hello, Miss Smith. Hi, I'm going to be your doctor today at the ER. So your doctor actually sent you here because of your blood pressure. Excuse me. We are very concerned because it was 180 over 110, but they actually just checked it, and it's now 220 over 140, which,
High score.
yeah, it is very high blood pressure, and we are very concerned. So, do you have any questions for me?
Yeah. Me?
Do you have any questions?
Why's your gown smell like freaking crap?
I'm so sorry. We can get a new gown if you'd like.
Can you get any?
Is it okay if I take a look in your eyes? Just look here at my mask. Can you take a look at me? Miss Smith, can you take a look at me? Okay, can you try to follow? Can you try to follow my light? Okay, do you know where you're at?
Pretty sure the stupid doctor's office.
Okay, you're actually now at the emergency room. The EMS just brought you here. Do you know what year it is?
2020.
It is now 2021. And do you know who the president is?
Yeah. Do you?
I do. Thank you for asking. All right.
On three, let's say it.
Okay, go. 1,
1, 2, 3. Donald
Biden.
Trump.
All right. We now have a new president. So I'm getting a little bit more concerned. She's showing neurological signs now. So
She probably just had too much to drink.
that maybe progressed it. We will talk later whenever you're better and your blood pressure is lower.
I don't know who asked you to come anyways.
All right. We won't get you wound up. I'm gonna get some medication for you and get that blood pressure down, okay? So this and we'll get you a new gown. Yeah, okay. So, I'll just show you this medication that we're gonna give you is, it's a vasodilator, and it's going to dilate your blood vessels. That way,
So I can have a baby?
no, ma'am. Okay, I'm sorry, I didn't mean to laugh at that. But one major thing we want to keep track with this and monitor, you're not having a baby, hon.
Okay.
But your blood pressure is very high.
You said dilate, so.
Correct, your blood vessels. But okay, we'll move on. So something that this medication can cause is hypotension, which is where your blood pressure drops really low, and then that could cause an even worse situation, okay? So we want to kind of like get your blood pressure down, but not too fast and not too slow, because we don't want to have any of those issues like heart attack or stroke. Okay? So, do you have any questions about the medication?
No. So I'm not.
You're not pregnant?
Gonna be having a kid from this medicine?
No, ma'am. No.
Okay. Then no. That's fine, I guess.
Okay, I'm gonna go get the medication. We'll be back.
Do you have a light? No.
What medication do you anticipate the doctor giving Trixie? About 5 minutes after the IV push of sodium nitroprusside, Trixie's blood pressure went down to 174/96. Her vitals are being monitored every 15 minutes. Trixie's headache is now a 6 out of 10 on the pain scale. Her heart rate is 90, her respirations are 20, and oxygen level is 95% on room air. Trixie has now agreed to go to Life Springs and get the help that she needs for her addictions and to get back to Doug very soon.